Compensation Support Payment Program. We have about 150 people on the call today and some colleagues from DHS and the Minnesota Children's Cabinet. We are so glad you're here, and noting that this is the first information session for this new program. We are also offering similar sessions this week for family childcare providers and certified centers. This event today is for licensed centers, and we're carrying out these information sessions this week ahead of the new program's launch in October. We last held information sessions in early July on the transition grants that have just concluded. And as with those sessions, today's WebEx is being recorded, and it will be posted on the DHS website for the Compensation Support Payment Program in the next few days. We will send you an email with the website and encourage you to visit it soon to view the recording if you need to and for more information. Launching a brand new program is a big undertaking, even one that is similar to other recent programs, and we are thankful to Minnesota legislators and community leaders for their support. And more importantly, we're grateful to you, Minnesota's childcare providers. Thank you to those of you who sent us questions in advance of today's session. We have worked to incorporate responses to those questions into the presentation. And also, we had the privilege of engaging with almost 40 childcare providers in engagement events in recent months, and are deeply grateful for their time and good and hard questions and great suggestions. Finally, thank you for just taking time out of your busy day-to-day to learn more about this new program and the work you do each and every day to support the early childhood educators in your programs and the children and families in your care. Before we begin, we'll do some quick introductions of the state staff who are on the call today. So I'm Deb Swenson-Klatt. I'm manager of a team called Child Development Services in DHS's Child Care Services Division. And I'll turn it over to Jeff.
Good morning, everyone. My name is Jeff Smith. I'm a project manager in assisting with this program as well as a number of others. It's good to talk to you.
And Nolan.
Good morning, everyone. My name is Nolan Fine. I work under Deb on the Child Development Services team, and I help administer the Great Start Compensation Support Payment Program.
Thanks, Jeff and Nolan. For all listening, I and Jeff and Nolan will be your presenters for the day. We also have on the call today listening in Jenny Moses, manager of the Minnesota Children's Cabinet, and she can't pop on to say hello because she's in participant mode, but she is here listening and is a key supporter and partner of this new program. So let's turn to the next slide and we'll walk through the goals for today's information session. Today, we are aiming to provide you with a wide range of information to help you prepare for the first application of the new program that is, again, opening this month. So we'll walk through an overview of the program. We'll talk about the new program by comparing it and contrasting it with the child care stabilization based grants. Because we know there's such strong familiarity with the previous program. And then we will talk about some important program requirements, address common questions that you've sent us. We'll then share some upcoming key dates and help you know where to go for more information. So here's a bit of information about the new program's purpose. The compensation support payment program was signed into law in May of 2023, providing Minnesota with additional funds designed to support the childcare industry and early childhood educators. This is a nation-leading program that builds off of the childcare stabilization-based grants, and the program will issue monthly payments to eligible childcare providers to fund increases in compensation and benefits for early childhood educators. The program starts this month following the end of the transition grants that concluded in September. The application process will be similar to the stabilization-based grants and transition grants until we move the application into the new provider hub at some point in next year in 2024. Importantly, this is a permanent new program, and we want to just explain that the legislature did appropriate varying levels of funding for each of the next 4 years. For this year, fiscal year 2024, all the way through fiscal year 2027. In total, across those 4 years, the legislature appropriated and the governor signed into law funds totaling $618.4 million. Like the stabilization-based grants and transition grants, the payment award amounts are determined based on the total funding we have each year and calculated by based on the number of full-time equivalent staff who regularly care for children. Given that there's a little bit of variation in the funding levels, that might mean that there's some fluctuation in the amount per FTE that you will receive in your monthly payment. However, our aim is to have as little fluctuation year over year as possible over these next 4 years so that you know what to expect in your funding that you receive through your monthly payments. We know that this is important to providers to have that stability or that understanding of what to expect. There are program requirements that are similar to the stabilization-based grants, and there are some differences. So in the next few slides, I'm going to talk about the similarities and differences. So starting with what is the same? How is the new program the same as the stabilization-based grants? Regarding the program design, the program will continue to have an application that is emailed to you as providers. It is an individualized application that will be sent on a monthly basis. The previous month is the funding period for the application that you are completing and for the hours that you report. Providers must be open, operating, serving children and in an eligible license status to receive funds. And the use of funds is the same as in the previous program in that the focus of the program is increasing compensation and benefits for early educators directly caring for children. Regarding payments, there are also some similarities between the new program and the previous program. The payment amounts, as I've mentioned, are based on the number of hours reported for early childhood educators, and the hours that can be counted are those directly caring for children. And like the old program, there is an opportunity for programs who serve families receiving childcare assistance and or the early learning scholarships to receive a 10% increase in their monthly payment. So what's different about the new program? We have a few slides to highlight those differences. And you might notice that there's increased flexibility compared to the old program in some ways, but that there are also changes that the law for the new program requires in order to protect against fraud and misuse of funds for the new program. These measures will ensure that the program can operate into perpetuity and with public confidence. So regarding the design of the program, oops, we've got a few slides flipping back and forth. There we go. Thank you, Jeff. Regarding the design of the program, one difference is that now in the new program, one early childhood educator can count for up to 2 full-time equivalent staff. There is no longer a prohibition in the new program against involuntary furloughs and the laying off of employees. There is no longer a requirement to maintain wages when staff are not working. And there is no longer a requirement to the best of your ability, provide tuition or co-payment relief to families. In the new program, legal non-licensed home-based providers receive a different type of payment that looks very different than those payments provided to licensed and certified programs. And the new program does not have the financial hardship grant available. When we think about children, when we think about the program from the perspective of the children in care, there are some new differences. A provider must, in the new program, care for a minimum number of children in order to be eligible. And providers must record and report child enrollment and daily attendance, although there will not be the need to report this in detail until mid-2024. These, again, are program integrity strategies in law for the new program that we'll talk about a little bit more. Although I mentioned that the 10% increased payment still exists in that was in place in the Child Care Stabilization Program, there's also a new twist to this. In addition to being eligible for a 10% increased payment by serving a child receiving child care assistance or early learning scholarships, if your program is located in what is called a child care access equity area, even if not serving children receiving CCAP or early learning scholarships, you will also be eligible for this 10% increased payment. And the child care access equity areas are being developed by our department utilizing U.S. Census tract data that pertains to numbers of families with inadequate access to childcare, high poverty and unemployment rates, and low home ownership rates and median household income. There will be more information coming about the access equity areas. In addition, there are some new reporting requirements. Providers should expect to complete an annual report, a report that follows 12 months of receipt of payments, describing how you used these funds. And in the very short term, between October and January of 2024, providers must complete the market rate survey as a condition of receiving payments during that time period. And finally, there are some specific differences for licensed and certified centers that don't apply to family child care providers. And we'll focus in on these a bit more as we go through the presentation today. So how is the new program different from the stabilization-based grants for licensed and certified centers? One important difference is that in the new program, programs must use 100%, not 70% of the funds to increase early childhood educator compensation and benefits. There is, because of that, no waiver process to be exempt from utilizing the funds for this purpose. Funds must also be distributed to the early childhood educators in your program within 6 months of receipt. So from the funds from October's monthly payment must be distributed within 6 months of receipt of that month, for example. And then finally, establishing a baseline for early childhood educator compensation will be important for this new program because of the overall purpose of increasing compensation. So we'll talk more about that as well. So next, we'll move on to more information about these important requirements, and I'll turn it over to Nolan.
Right. Thanks, Deb. As Deb mentioned, we'll now move on to the important requirements of the compensation support payments. These requirements are either new or changed from Child Care Stabilization Base Grant requirements. These requirements are in the law that created the Great Start Compensation Support Payments Program and are intended to protect against fraud or misuse of funds for this program. These measures will ensure that the program can operate long-term with public confidence that the funds are being used as designed. So you can see here, there's a list the requirements will be covering. So there's daily attendance, a minimum number of children served, baseline compensation for determining increased compensation, record keeping, and annual reports. We'll start by covering daily attendance requirements. So what are the daily attendance requirements? The requirements are that providers must record and report daily attendance, including a child's first name and last name, the date, and the check-in time and check-out time. Why are these items being required? Daily attendance requirements are in the law that established, noting that DHS must establish a minimum number of children served for provider eligibility. This is an important protection against fraud and misuse of funds, ensuring that child care programs are actually in operation and caring for real children. How will daily attendance data be collected? Initially, the information required will be limited. Full daily attendance records will need to be reported when the application moves to the provider hub in mid-2024. DHS is still developing the method by which daily attendance records will be collected. However, providers must make available daily attendance records upon DHS's request at any time. The October 2023 compensation support payment application will ask the following question related to your program's daily attendance. What was your program's highest attendance on a single day during September 2023? This question will remain in the compensation support payment application until the submission of daily attendance records is required, again around mid-2024. You will also be asked about your program's enrollment in a more simplified way as compared to transition grants. So as you can see here, we'll be asking simply for the enrollment by age group in a typical week from September 1 to September 30. So there'll be no more breakdown for full or part-time children. The law also requires that DHS establish a minimum number of children served for program eligibility, as mentioned earlier. This is, again, an important protection against fraud and misuse of funds, ensuring that a minimum level of service was provided in return for state funding. So the how this exactly works, the minimum will be for licensed childcare centers 25% of licensed capacity, or if licensed capacity is 12 or fewer, it will be a minimum of 3 children served. There will also be an exception for programs that opened within the last 6 months. For those programs, the minimum will be 15% of licensed capacity, or if licensed capacity is 12 or fewer, it will be 2 children. So to break this down a little further, the minimum number of children must be in attendance on at least 5 days during the previous month. The previous month is the funding period for your application. And here we have an example. So for the October 2023 compensation support payment application, a licensed childcare center with a licensed capacity of 100 must have at least 25 children in attendance for at least 5 days during September 2023. So this program's October 2023 application will ask, how many days did you care for at least 25 children in a single day during September 2023? Again, the minimum number of children will adjust to your program's license capacity. So it won't be 25 for every program, but just for the program in this example. And now I'll hand things over to Jeff to continue with important requirements.
Good morning again, everyone. I'm going to talk initially about baseline. This concept of a baseline is a new concept. And so we want to explain it a bit further. Why do we have it? How is it going to work? In general, childcare centers will need to provide information so that DHS can determine whether early childhood educators are receiving the increased compensation over time that's required in law. Why are we doing this? I mean, this is, again, really the program's primary purpose, to increase early childhood educator compensation. The law requires compensation and benefits to be increased for those early educators. And in italics here is quote directly from the law. Childcare centers must use money received under this section to pay for increases in compensation, benefits, premium pay, or additional federal taxes assessed on the compensation of employees as a result of paying the increased compensation or premium pay to all paid employees or independent contractors regularly caring for children. So what is baseline compensation? Really, it's intended to get at the amount of your program's total personnel costs during the month prior to receiving your first compensation support payment, minus any stabilization grants or transition grants that you expended for personnel expenses during that month. And I'll show you an example in just a second. It's a lot of words, but the math is pretty simple. Again, why is establishing a baseline important? It's really to help providers meet the requirement to use 100% of the funds to increase compensation by being able to compare the baseline compensation to your future reported personnel costs. This will also support providers in planning for both short and long-term use of the funds, and support you in distributing the funds to employees within that 6 months of receipt that Deb had mentioned earlier. That's also a requirement of the program. So here's a bit of an example of how it will work. In the October application, it will ask for 2 pieces of information. It'll ask for personnel costs, which is a question that licensed centers have been answering every month. The definition of personnel costs has not changed, so that is the same approach you've had month over month. One new question that is going to be asked is the grant funds that were distributed to early childhood educators. So in the example below here, we've got the basic math on how we're going to determine the baseline. We're going to look at a single month and remove the grant funds from your personnel costs. So assuming that this example center has 5 FTEs, their total personnel costs, so this is wages, bonuses, benefits. Those benefits can include everything from health, dental, vision, retirement, professional development, as well as employment taxes, or the provider's portion of the employer taxes. The total personnel cost for this example provider is $21,000. And that will be asked in the application. The other question that will be asked is the amount of grant funds that were distributed to early childhood educators in the month of September. In this example case, we're doing the October application. And in their example, they distributed $3,000 worth of grant funds. So simply subtracting the 3,000 from the 21,000 gets us to a baseline compensation of $18,000. And if we want to look at that on a per FTE basis, since they had 5 FTEs, that would result in a $3,600 per FTE. The important thing to know here is we are not expecting any of you to do this calculation per se. All we're doing is asking for personnel costs and grant funds distributed in the first application that you complete. DHS will then calculate this baseline and the baseline compensation per FTE. We know this is a new concept. We will provide additional information on the website about this, so you can kind of look at it, think about how it applies to you, and are prepared for that. But that's the basics of the baseline compensation. So moving on, another really important component of the program is record keeping. Providers must document 3 main things on a regular basis. So the daily attendance records must be completed every day, and Nolan had talked about that earlier. Providers are also required to document how they're using the funds. So again, some providers may use those funds in a consistent way every month. Some providers may vary it. Some providers may vary it by even early childhood educator. And then the final thing, the third bullet here, is early educator employment, compensation, benefits all need to be documented as well. And that includes timesheets, any other records of daily hours worked, the documentation of compensation and benefits, documentation of written changes to employees' rate or rates of pay, and the basis thereof as a result of these payments. This information is not required to be submitted at this time. It's just that you need to keep these records and have them available should DHS need to review them for any reason. And then finally, the annual report. The annual report is also a new concept that's being introduced with the new program. The idea behind the annual report is that providers will complete one after 12 months of participating in their first compensation support payment application. The report will be relatively brief and really focus on how you spent the funds that you have received over that 12-month period. In many ways, at least one of the things that have been historically in the applications will be removed. So every month we've asked, how are you planning, or how have you used the grant payments that you've received in the past. We're going to remove that from the monthly application and just put that in this annual report. This annual report is still being developed. And so we will be sharing more details about the annual report in the future. We will give providers plenty of time to be able to prepare and complete that. We will likely have another webinar to explain that report in a greater level of detail so that everyone's prepared and ready to do that once that happens. Again, it won't be for 12 months until anyone needs to complete an annual report. So we've got plenty of time to talk in more detail about that. Okay, now we're going to transition to some of the common questions that were sent in by providers that we would like to address. By no means are we going to hit every question that we've received, but we did want to address some of the more frequent ones. So let's jump in. Nolan and I will sort of tag team this effort. The first question that we've received pretty frequently from both centers and family child care providers is, do providers need to record exact sign-in and sign-out times for children's daily attendance?
The answer is providers are expected to be as accurate as possible.
The second question we've gotten pretty frequently is, what is the dollars per FTE going to be for October as this new program starts?
The answer here is DHS is still finalizing the October 2023 amount per FTE, but is expected to be between $365 and $375.
And that really goes back to one of the things Deb said earlier in the presentation, where we are striving to keep the payment amounts as consistent as possible so that all of you can plan. Obviously, this dollars per FTE is going to be based on participation. So we will look at that in the future, which I guess I got ahead of myself in terms of the next question, which is, will payment amounts be consistent in the future?
The answer here is DHS's goal is to keep the dollars per FTE payment amounts consistent through June 2024, at which time we'll reevaluate the funding amount based on participation in the program.
Sorry, I stole Nolan's thunder a little bit there. All right, and the next question is, what does it mean that the program is permanent?
The answer is that the law that created the program did not establish an end date for this program. The program will continue unless future legislation is passed to remove this program or end it.
And then, Nolan, will there be any funding available for technology upgrades to assist with daily attendance tracking?
There are at least 3 current or future programs that providers can take advantage of that could assist with providers upgrading their technology in regards to attendance tracking or any other needs. So the first one we list here is the Child Care Provider Technology Grants, which have not been rolled out yet, but are being administered by DHS. So we'll share that information as that program becomes available. There's also quality improvement grants for Parent Aware, which I think you can find more information on these grants on Child Care Aware's website. Then there's also regional Child Care Aware grants, which you can also find more information about these grants on Child Care Aware's website. But all 3 of these sources of funding can be used to purchase technology related to your businesses.
Excellent. And then one question we have been getting since this attendance tracking requirement is new is whether attendance affects the award amounts or not.
The answer is no. Attendance affects whether a provider is eligible for payments, but it does not affect the amount of the payments. Again, yeah, payments are still based on the number of hours staff worked directly caring for children.
Excellent. All right, so here's a couple of important upcoming dates. So the compensation support payment application will open on Monday, October 16th, so 2 weeks from yesterday. The application is going to be open for 10 days and close on Wednesday, October 25th. That's 2 days longer than historically we've had the application open. We did get some feedback that having that open a little bit longer would be helpful. We also are going to extend the closing time by about a half hour. So instead of 4 o'clock, it'll be 4:30 to make it, again, a little bit easier to get the applications done. As always, though, we strongly encourage you to apply at the beginning of the application period. And with 10 days, there should be plenty of time. It'll cover 2 weeks a little more easily than in the past, where it was just 8 days and it sometimes would just go 1 day into the next week. Please apply early. That avoids any technology problems, unexpected illnesses, or surprises at the end of the application period. So while we extended it, please do apply early. And as we have been, we're going to stay consistent with our cadence that applications are going to typically open on the 15th of each month, except as October is an example, where the 15th lands on a weekend or a holiday. In looking forward at the calendar, it won't happen again until like May or June of next year, where the 15th is on a weekend or a holiday. So we should be good for that. You can count on it opening on the 15th. And then if you want more information, please do go to our website. We're going to be launching brand new, much more detailed websites today on the compensation support payment program. The link that's here gets you to a main landing page that will have links to both the transition grants, which just ended, and the new program that's starting. And that new program page will go live at some point today. It will contain information about everything from eligibility, award amounts, application periods in the process, requirements, the allowable uses of the funds, as well as a frequently asked questions section. This can always be your first stop if you ever have any questions. We do our best to get the commonly asked questions incorporated in many cases, multiple places on the website, both the general information and then inside the frequently asked questions page, which will be separate as well. We are going to post this PowerPoint as soon as we can today. So if you do want to go back and review anything, you can. And then we'll be posting the recording as quickly as we can. There's some processing that has to happen before we can post it. That usually takes about a week. So we'll get that up as quickly as we can, both so you can review it if you're interested, but also if you know of colleagues that were not able to attend today, but would be interested in watching the recording, they can do so in the future. And then finally, big thank you. Because of the large size of this, we haven't been able to take chat or questions live. So if you do have questions, comments, suggestions, please do email us at either supportfunds@childcareawaremn.org and/or compensationsupport.dhs@state.mn.us. And thank you again for your time today, as well as your service to all of your wonderful children that you care for, and look forward to talking to you all soon. Deb, any final closing words?
No additions from me, except for, again, another thank you to all. And please do seek us out if you have questions or suggestions about the new program. Thank you and have a great day, everyone.